Newly released research could give breast cancer patients more confidence when deciding whether to undergo chemotherapy or skip it altogether while fighting the disease. News 8's Brittany Schmidt joins us now to explain.
Lisa, hundreds of thousands of people are diagnosed with breast cancer every year, and usually chemotherapy plays a role in fighting the disease. But what if chemo would have little to no outcome on how you get rid of the cancer? Would you still go through it? Well, newly released data supporting a gene activity test is expected to help people make that decision. When someone is diagnosed with breast cancer, there are many routes a patient can take.
If they're thinking of a lumpectomy, they may see the radiation therapist. If it's a very large lesion or other characteristics that are bad prognosis, they may see the medical oncologist.
One of the last steps is usually chemotherapy.
The idea is it's going to kill the small, undetectable deposits of cancer elsewhere in the body.
But the results of a new study shows not everyone necessarily needs chemotherapy to beat breast cancer.
If they have very low risk, we may say, well, it was small in size, it's got favorable characteristics, hormonal therapy may be all you need.
A study published by the New England Journal of Medicine conducted a gene activity test on more than 10,000 women diagnosed with an early stage of breast cancer, including 15 from Gunderson Health System.
The study, the TAILOR-X, is using a 21 gene array that's been commercially available called Oncotype DX, which gives us a low risk and a high risk score. There's been an intermediate, which is questioned whether or not they may benefit from chemotherapy.
Of those who scored a low risk and skipped chemotherapy, less than 1% had a recurrence of cancer in another part of the body 5 years later.
It reaffirms that the women we thought were at low risk are at low risk, and that hormonal therapy is sufficient for them.
Dr. Kwong says one of the biggest obstacles for many who are diagnosed with cancer is the uncertainty of what's going to happen.
There are no 100% yes or no type answers that we can usually give patients.
But the new research validates what doctors have been practicing for a while now and gives patients one more tool to help decide the next step with their doctor.
And so the easier we can make it after the test is done, the easier it is on them.
Although the test has been widely available for years, not every patient benefits from the test. Dr. Kwong says most patients already know if they want chemotherapy or not by the end of their treatment. And there are certain cases where you may be considered low risk on the test, but other factors put you at a higher risk of getting cancer again. So it's always important to consult with your doctor if you have any questions.
All right, thank you, Brittany. The cost of the gene test is a little more than $4,000, but it is widely covered by insurance.